Hello, and welcome to the latest episode of our Heart Connection virtual webinar series. This month, we are discussing topics related to the importance of lifelong care. My name is Becca Kalivas. I am the Education Director for Conquering CHD. I will be your host and moderator for today's webinar, Advocating, Navigating, and Managing Your Path, School, Work, and Disability. On today's episode, we welcome our expert presenter, Estella Moore. Estella is a licensed clinical social worker and a certified case manager. She is the social worker for the Emory Adult Congenital Heart Center in Atlanta, Georgia, where she has served for 14 years. Her prior experiences have been as a full-time caregiver and as a manager at Grady Healthcare over OBGYN Social Services, Grady Rape Crisis Center, and the Healthy Mothers to Babies Best Start program. Welcome, Ms. Moore, and thank you for joining us. We will start today's webinar with a presentation from Ms. Moore about disability and disability accommodations in school, college, and the workplace. Before I turn things over to Ms. Moore, a few housekeeping notes. Following the presentation, we will be answering questions submitted by you all using the Q&A feature at the bottom of your screen, as well as those we've received via social media. If we don't get to your question live during the webinar, or if you have follow-up questions, please email us at info@conqueringchd.org. Ms. Moore will not address specific questions to your medical diagnoses, but will speak in generalities and provide relevant resources for families to learn more. As always, with the information learned, we encourage patients and families to discuss their specific concerns directly with their care team. With that, I will hand it over to Ms. Moore to begin her presentation.
Thank you, Becca, and thank you, CHD community. Becca, let me check in and make sure that we're doing okay.
We are good to go, yes.
All righty, okay. So we'll go ahead and proceed. I will start with my disclosure statement. This presentation is practice-based. It's based solely on my professional knowledge and experience as a social worker with the congenital heart population. It is not meant to provide legal advice or to take the place of legal advice. And we'll go to the next screen. My goal is to empower you, the congenital heart patient, and parents of congenital heart patients, so that when accommodations are needed, you are emboldened to advocate, to navigate, and to manage your path. Next. We have a mutual goal, and that's a long, healthy, quality life. And to that end, we emphasize staying in care, steering our patients to go as far in school as they are able or they want, and to ultimately get a job with a major employer that offers group insurance coverage so that they can get full health, disability, life insurance, and all benefits that are possible. Next. Advocate, navigate, negotiate, manage. Next. So this means you will need to speak up to teachers and to counselors, and sometimes you'll need to go beyond them and reach out to the school district or the school systems. Definitely talk with your physician offices. You may very well have to talk with your legislators and write your legislators, communicate with your HR, be knowledgeable about your HR benefits. And definitely when we talk about disability, much communication with Social Security Administration, much advocacy there. Next. Ask questions and speak up, take the lead, oversee your path. My comments will not have meaning to everyone, but I do hope it'll be helpful to those of you who are seeking accommodations or who are on the path to disability. The tools for accommodations in the school setting are the 504 plan and the IEP. And we will also talk about accommodations in the work setting. And we're just going to jump right in and start talking about the 504 plan and the IEP in the school setting. There are federal laws to help ensure that if your child with congenital heart disease has special learning needs, then your child is properly evaluated, their learning needs are assessed and addressed, and the appropriate accommodations or modifications are put in place. I put this piece in here about FAPE because when you're researching and going through this, you will often see reference to FAPE, and that is free, appropriate public education, and that is guaranteed through federal legislation. If your child's teacher or your doctor or you have concerns, then it may be an indicator to request an evaluation. And the place that you would start is with the teacher. You may go beyond then to the counselor, but that's where you get started with requesting for a 504 plan or an IEP. Next. The 504 plan and the IEP are both out of federal legislation. The 504 plan comes out of Section 504 of the Rehabilitation Act of 1973 and the Americans with Disabilities Act, often called ADA. It comes out of civil rights legislation that prohibits discrimination on the basis of disability in programs and activities that receive federal funds. The IEP comes out of the Individuals with Disabilities Education Act of 2004. And additionally, it provides federal financial aid to both states and local education to put the accommodations in place. Next. The 504 plan requires schools to eliminate barriers that would prevent students from participating fully in programs and services offered in the general curriculum. It requires a service plan with reasonable accommodations. The 504 plan is usually less specific than the IEP. It is reviewed annually, but is only required to be revised every 3 years. A bit different from the IEP, which is a very detailed statement, a very detailed map that has specific measurable goals. And this is revised at least annually, can be revised more frequently if needed. And that's where you are sitting down at the table with hopefully the student, but also the team of educators, teachers in the various disciplines, counselor and school social worker, psychologist, and it answers who will do what, when, where, how often, and for what period of time. It's a very, very detailed document. Next. The IEP ends after high school. For those going on to college, they will be asking for a 504 plan. Students can request disability accommodations in college, and typically that's going to be through the Disability Services Office, and more recent years they're calling that accessibility services. But that's where students are going to plug in to request accommodations in college under the 504 plan. Next. These functions you are going to see throughout this presentation because these are our basic everyday functions, the everyday things that we need to do And you will see them as we talk about accommodations in the school, accommodations in the workplace, and as we talk about disability. These functions, walking, breathing, eating, sleeping, communicating, seeing, hearing, speaking, reading, concentrating, thinking, learning, standing, bending, lifting, working, interacting with others, memory. They're very important, and I'll keep coming back to them. But for the 504 plan, you will have to identify which of these functions, physical or mental, limit your child's ability to learn. But we'll be coming back to these functions next. The goal of the 504 plan is for students to be educated in the regular classroom alongside with their non-disabled peers. Next. Every effort is made to keep them again with their peers, but sometimes additional support is needed. And oftentimes with the IEP, you will see that it will go beyond that, and it will provide for education in a specialized classroom that can provide for more one-on-one instruction. Next. As I said earlier, the IEP will have very measurable annual goals, quite a bit of progress reporting. Next. All schools will have a designated 504 coordinator that you can talk to, you can make requests to for the 504 plan or the IEP, and your child will be appropriately evaluated. You can start by asking of the teacher, the counselor, and then if you need to go beyond that, to the principal. Accommodations are grouped into 4 categories. Accommodations according to setting, accommodations according to time, and according to schedule and organization. Next. Some examples of accommodations, setting accommodations, would be a student who needs to test in a different setting or in a quiet room, or may need to work in a room with fewer distractions. Also, where there may be seating preferences, where a child who needs to sit near the teacher or sit closer to the blackboard or the whiteboard. Next. Accommodations in terms of time would be someone who needs more time to complete a task. Also may need to take more frequent breaks. So it may be written that after completing a worksheet, the child gets a 10-minute or the student gets a 10-minute break. But that's an example of a timing accommodation. And organizational accommodations, an example of that. Next, an example of I'm jumping ahead of myself, scheduling accommodations would be taking more time to complete a project. So the child is given additional time, and that's all mapped out and agreed, whether it might be 1 week additional time. Also, testing in a different way. It could be where the test is broken up into sections. It could also be a stipulation that a child has no more than 1 test a day. So they don't have a test in history and a test in English and a test in math all in the same day, where that child is required to prepare for 3 or 4 tests one day. So scheduling accommodations, there are different ways in which that can be done, particularly as it pertains to testing, taking a test at a specific time of day. Next. Organizational skills. And so this is what I was referring to earlier, but the child could use an alarm to help them with time management or other tools in the classroom. They can mark their test They're texts or tests with a highlighter. And they're helped by using a planner or organizer to help them to coordinate and complete assignments, and may receive particular tools and helps with study skills. And there are times when accommodations are not enough and modifications may be what's indicated. When modifications are called for, then some examples would be that the child, the student, is meeting a different standard than their peers. There is some adjustment in the standard that they must meet. And they could have different learning materials. They could have a reduced schedule. They could be excused from particular projects where they just don't have to do it. Or they could have alternate projects or assignments that they do. Their tests could be different and answer different test questions and complete different homework problems than peers. Modifications take it to another level than accommodations. Examples of accommodations that you can request for your students. We talked about preferential seating, but that's an example. Getting class notes ahead of time. Extended time on tests and assignments, reduced homework or classroom work, verbal, visual, or technology aids, audiobooks. Also, if needed, behavioral management support can be built in. Verbal testing, where the teacher is asking the questions to the student. Other examples are excused lateness or absence or missed classwork, pre-approved nurse office visits, accommodations during gyms, such as breaks after every 10 minutes of exercise. There are several differences once that IEP ends and we're talking about collegiate accommodations. There again, it's no longer the IEP, it's the 504. And the main difference is that the student is the person requesting. It's no longer the parent. And the parents are no longer involved unless the student gives permission. Many of the accommodations that we already talked about are also accommodations that can be requested in college. Additional ones that are typically asked for include having a note taker for class lectures, having permission to make audio recordings or use their laptop in the classroom, and taking exams in a distraction-reduced room. Now, I put this in here because there are other issues that may arise with congenital patients. I've had a few things outside of the box. I have had congenital patients who have, as the parent, has needed accommodations. An example was a congenital parent who was required to walk almost a mile getting her children to the school bus pickup at the gate of the apartment complex. And she was not able to do that. So we had to ask for accommodations for our patient, our congenital heart patient, to help her with her children. We had to go beyond the normal request. We requested that. I had to take that all the way to the school board, but different variations of accommodations can come up. Next. An additional point I wanted to make is that when I'm talking about accommodations in the collegiate setting, I need to emphasize I'm not just talking about young people. I have patients that span the age range from young adult to quite mature age. who are connected with disability services at their particular colleges and universities and are receiving a gamut of accommodations. So this applies for congenital patients of all ages. An additional point that I did want to note, the Affordable Care Act made it possible for parents to keep their adult child on their private insurance up through the age of 26. But there may be some of you out there whose child is approaching 26, but that child may be what we call an adult dependent. And I just wanted to make sure you're aware that you can reach out through your job, your human resource department, to be able to keep that child on your health insurance beyond 26. And here we will go back to looking at some of those functional limitations that we looked at earlier. Where there are limitations, there may be limitations with walking, limitations with memory, limitations with standing, a child who is approaching age 26 but still living with the parent, and you do not see where that child has the capability of being able to live on their own but will need parent or adult supervision, then you want to pursue keeping that child on your insurance as an adult dependent. And in the military, I believe that term is as a secondary dependent. And some suggested resources for 504 plans and IEPs. There are many that are out there. Rights Law is very good. Understood is very good. And they have an app called Wonder. I must also note Parent to Parent is an excellent resource, state specific, but absolute excellent resource. And so there are a lot of resources out there, both for reading and audio visual under YouTube for more exploration and to get more in depth on 504 plans and IEPs. We're going to jump right into accommodations in the workplace. Title VII of the Civil Rights Act of 1964 protects employees and job applicants from employment discrimination based on race, color, religion, sex, and national origin. And federal employees are covered under the Rehabilitation Act of 1973. There are a number of other titles there with other guarantees, other protections, but the Civil Rights Act of 1964 affords us that protection. And the Americans with Disability Act, also often referred to as ADA. ADA regulations require government and state entities with more than 50 employees to have at least one designated coordinator to oversee the efforts to make sure there's compliance with ADA legislation and to investigate any complaints. And the ADA Amendments Act of 2008, ADAA Act, it broadened the definition of disability, and the focus becomes whether a reasonable accommodation can be implemented to help an individual with a disability. All state and local governments are required to offer workplace accommodations when it is reasonable. Private employers with 15 or more employees. And the caveat is if your employer thinks it's reasonable, but there's a lot that you can do about that whole discretionary reasonable You do have some supports on your side. If you get to that level when your employer is saying it's not a reasonable accommodation, there are a number of supports where you can go further. And back to emphasizing our daily functions. When you are looking at accommodation in the workplace, you're going to have to answer, does your impairment substantially limit you in one or more life activities, and identify which life activity it is. These are the same activities that we looked at in school, in the school setting, in the 504 IEP. Here in the work setting, same functional activities. Additionally, you will see on many forms interacting with others, caring for oneself, problems with memory, performing manual tasks, and standing. Next. With workplace accommodations, you are responsible for making the request, and you will have a lot of homework. You will need to think through the questions that most accommodation forms will ask, and that's identifying the impairment, identifying the major life activity and bodily function that's impacted, and what accommodations are you requesting that you need to help you perform your job, and then how long is the accommodation needed? Excuse me. Part of your homework, review your job description. Identify the major job functions versus minor job functions or marginal job functions. Excuse me. We can go to the next. Does your HR have a designated representative or office that you need to work through? If so, connect with them. Find out who that person is. Also, part of your homework, review your employee handbook. And if possible, when you're making your request, put it in writing. You put it in writing in order to have a paper trail, because the way that you send it forward should be the way that it also, that you get your response or and your reply. And you'll definitely have to involve your doctor's office or your cardiologist to complete paperwork to confirm your disability. Employer responses. Well, hopefully your employer is going to respond by offering the accommodation. Some examples of accommodations include medical leave, reassignment to do something different, offering additional breaks if that's what's requested, a reduced work schedule. I get a lot of patients who get assistance with lifting restrictions, modifications to their workspace and their work environment. It may be a chair, it may be something different in terms of the computer. And I get a lot of patients needing and offered special parking accommodations. Hopefully, dialoguing with your employer will result in a win-win, and where the employer and you come to an agreement and you achieve a better work-life balance. The hard question, can your employer terminate you? Yes, that's the hard answer. And yes, based on medical reasons. If they can prove that you're not able to perform the essential functions of the job, or that you're not qualified to do the job, or that you pose a direct threat to yourself or others, or providing an accommodation would pose an undue hardship on the company. Now, there are many ways that you can appeal this and elevate this to other levels if it came to this. You know, a larger company might very well be able to afford modifications and accommodations that a smaller company could not. So the standard will change and will be different based on the company and what's being requested. But the hard answer to that is yes. I do have to say, in my work capacity, I've been here about 15 years and worked with a number of requests for accommodations in the workplace. And I can definitely count on one hand and have room left over of the employers and the companies that have not been able to come to some agreement to help my patients and to offer an accommodation. If you're having difficulty, you may want to seek the advice of an employment attorney. Oftentimes, employment attorneys will offer a free consultation, and then additional resources become the EEOC, the Equal Employment Opportunity Commission, and there are a number of other resources you could reach out to if you found that it wasn't going well. You weren't getting the accommodation, the reasonable accommodation that you requested. I plug this in because it's important to understand when you are in need of an accommodation that you're not alone. Chronic health conditions affect 60% of the US population, or more than 190 million people. And the CDC said across the country and in every age group, health conditions, illnesses, and disability affect millions of people. And according to the CDC, 1 in 4 adults, or 61 million people in the United States, are living with disability. So you're definitely not alone. And if you're in the workplace and you need an accommodation, then speak up and seek the accommodation. You may want to seek some expert advice as you're moving toward that accommodation. Definitely talk with your doctor, but do speak up and advocate for yourself. Next. In doing that, you do not have to reveal your diagnoses, your condition name, or treatment specifications to your employer or to anyone else. I will also say that there are state-specific laws, so it pays to know what the laws are there in your state. But the most important thing is that your employer understand what your work restrictions are, and back again to those functional limitations, that they understand the functional limitations you're experiencing because of either your physical or mental condition, and then what your ideas are for the accommodation that will help you to perform in your job. One additional note that I did want to make, just to provide information, if you're interested in working with the federal government, and you would look under usajobs.gov, but just as with veterans, there is a veterans preference, there is a sort of preference that's possible for someone who has a disability, and it's called Schedule A hiring. And with that, and you can Google Schedule A letter or Schedule A hiring, you get the letter, take it to your physician's office, your doctor, helps to complete that and sign off. And then when you're uploading whatever documents you're required to upload for that job you're applying for, whether it's resume or whatever, you upload your Schedule A hiring, Schedule A letter, and that will allow you to kind of bypass, to some extent, if the hiring manager is interested in you, bypass competing against non-disabled job seekers, and gives you a bit of a preference. Next. Suggested resources here are noted, and one thing I would mention in particular in terms of accommodations in the workplace is JAN, askjan.org, the Job Accommodation Network, a very, very good site, and of course EEOC. Next. There we are, EEOC. Okay, next. And for federal employees, oftentimes, if you have to file a complaint, oftentimes you can do that directly with your agency, because most federal agencies have their own equal opportunity office. Next. And we are going to move right forward into disability. Because disability, there's so much to be said about this, and we need to move forward so we can maximize our time to talk about it. So I'm talking about Social Security disability, and Social Security disability is administered by the Social Security Administration, and they administer a number of programs, but two disability programs. One is SSDI and the other is SSI. We've often heard of SSI. SSI is Supplemental Security Income, and SSDI, Social Security Disability Insurance. Some people qualify under one of these programs and some qualify under both. But either way, to qualify, you have to meet Social Security's medical criteria in order to qualify for disability. Next. So SSI, Supplemental Security Income, pays benefits based on financial need. This is the, if we look at SSI and SSDI, SSI is on the non-work side and SSDI is on the work side. SSI is the benefit, the disability benefit that would be available to a congenital heart disease patient essentially from birth. With application, they would meet the medical criteria, but it would be important that they also meet financial eligibility. So if their parents make too much money, they would not qualify. But if they qualify, meaning their parents are not over the financial limit, they will get a small monthly check, SSI, and they will also get Medicaid with it. The purpose there being to make sure that children under the age of 18 have health care and health surveillance and dental care as needed. SSI, Supplemental Security Income, on the non-work side. Next. Now, Social Security disability insurance is on the work side, and that pays benefits on the basis of what you've paid into the system. So there is a work formula, and you have to meet the work formula, basically having worked and paid into the system for 10 quarters or roughly 10 years. Now, there are little caveats in terms of that, but roughly 10 years, meeting the work formula. You pay into Social Security and you pay into Medicare. And for those who apply for disability and they meet the work formula and they're on the SSDI side, The piece is for healthcare insurance, it does not come right away. The healthcare insurance that comes with it on the work side is Medicare, and that comes in the 25th month of disability. So if you have a strong work record and you are now disabled and you apply for disability, you go through the process, you are awarded disability, then you have roughly a 2-year period where you have to get your own private health insurance. Medicare comes with SSDI, but in the 25th month. Social Security disability. Disability under Social Security is based on a person's inability to work, meaning they cannot do the work they did before, and they cannot adjust to other work because of their medical condition. Their disability has to have lasted or is expected to last for at least 1 year or to result in death. In other words, it's a permanent disability. And I emphasize that because I have people who will think that they can get Social Security disability. I'm having surgery. I won't be able to work for a couple of months, maybe after the surgery. And so I need short-term disability. No such thing under Social Security Administration or Social Security disability as short-term disability. Short-term disability is private insurance that most often you've paid for under your employer or that you have privately subscribed to. Next. So you ask, SSI or SSDI, how do I know which I apply for? I tell people when you're applying, apply for both. But the other thing that I think it is important for you to do, and another help, is if you Google or whatever internet you use, whether it's Googling, whether you Bing, whether it's Opera, Mozilla Fox, whatever, if you plug in there Social Security, and you want to go to the Social Security website, you want to make sure it's a .gov website. And there, you want to click on the tab that says My Social Security Account. If you go into My Social Security Account, and it takes roughly a minute or less, just about a minute to create an account, you will see your work history. You want to check your work history for accuracy, but then it will show you what you have paid into your work account over time. And it will give you an estimate. If you're disabled in and about this period of time, this is an estimate of how much you can expect to receive in your monthly check. I often say that to people, and I say that to people of mature years who may be thinking about, well, should I apply for disability or should I retire? Well, go into My Social Security account and take a look at what's your estimate of how much you will receive monthly in a disability check. And then you can check with your HR and call Social Security for an estimate of what you would receive as a monthly check with retirement. Next. When applying for Social Security disability, it is absolutely crucial to understand the process. Next. There are roughly 4 parts or 4 levels to the process that you have some control over. You have to go from one level to the next. And you can be thrown out at any one level if you don't progress to the next. So I sometimes say to my patients, think of it as a game show, and you get that horrible beep or whatever if you don't pass that level. If you don't make it and don't pass to that level, then that is it. The first one is, are you working? The next level is, if you have passed the are you working? The next level you go to is, Do you have a qualifying impairment? If you do, then you go to the next level, which is what's your functional status? If you get that far, then Social Security will take a look at your work history. And the question there becomes, are you able to do a job that you did before or not? But if you get through that level, 1, 2, 3, 4, that next level is all Social Security. That's where they call in the vocational rehabilitation specialist, and they answer the question. But your objective is to be able to get through 1, 2, 3, 4, and then you have done what you need to do to try to apply for disability and complete that process. Next. Are you working? If you are working, it's very unlikely you will qualify for disability. I say that for two reasons. One, because a part of the definition of being disabled is not being able to work. And so if you are working from Social Security standpoint, you have kind of already answered that question. The other thing that Social Security looks at is what they call substantial gainful activity, and or SGA, and the amount is in 2022, the amount is roughly $13.50 for an individual. The substantial gainful amount, I stand corrected, that's what the SGA stands for. And if you are making as an individual over that limit, then you're very unlikely that you're going to be able to progress to the next level. Now, there are a few exceptions, and that gets into things like deductions that may come out of that $13.50, generally that are related to work. But basically, if you're under $13.50, and I do have some patients who may be working, for instance, 1 day a week or working 2 half days a week, and they will qualify. But generally, if you're working and you're making over $13.50, you're not passing to that next level. Next. What are your diagnoses? Do you have a qualifying impairment? Now, Social Security has what is called the Blue Book. Very similar to, we have a Blue Book we get for cars that give us an estimate of the value of our car. Social Security has a Blue Book. You can Google that. You can Google the Social Security Red Book. In that Blue Book, they write almost every kind of condition you can think of. Social Security divides the body into 14 different subsystems, and there you will find every diagnosis, every impairment, the specifics of it, the tests and the procedures that may be necessary, the surgeries, and all of the details. And you may want to look that up in terms of your defect. Basically, when you are completing an application for Social Security disability and you are filling in your diagnoses and your impairments, it is very important to be thorough, because it may be the case that your congenital heart disease diagnosis in and of itself is not an impairment that keeps you from working. But maybe you have other things going on that when you put it all together, it keeps you from working. And that's what we call comorbidities. But that application that you file with Social Security stays alive, and that's what they will assess your application on. So it's very important not to leave anything out that you believe to prevent you from being able to work. Next. And this is an example of the Blue Book. Next. Included under what are your diagnoses, and this is still going through the process of what you're filling out for Social Security. They will want you to list your recent hospitalizations, your clinic visits, medications, medical tests, surgeries, procedures, give what dates you have for that. You're not responsible for providing your records to them at the time that you apply, but you are responsible for providing the contact, the names of the providers you've seen, facilities where you have been and where you've been hospitalized, and the contact information for that. If Social Security is not able to get your records after requesting them, then they may send you a notice that they've not been able to get your records, and then they will tell you and give you a period of time, very brief period of time, in which to get your records. Next. What are you able to do? That's where we are back again to those functional activities that we looked at. So an example, if you say, I am so fatigued, I'm so worn out, I'm so short of breath, all I can do is sit and watch TV all day long. That does not say to Social Security that you're disabled and you're not able to work. That says to Social Security that they may be able to plug you into a sedentary job where you can sit all day but get paid for it. Those functional activities are very, very important. So you want to there be able to list everything that you have difficulty doing. So I tell people to think of it. So with the functional activities, they're often called activities of daily living, the things we have to do every day. I tell people, think of it in terms of long addition. And so are you able to get up in the morning and shower and bathe? Yes, I'm able to do that. I am able to groom. I am able to brush my hair. I am able to shave. I'm able to fix my breakfast. I am able to drive. And then the instrumental activities of daily living. I am able to shop. I am able to do light housekeeping. I am able to vacuum. You line those up in a column, one after another, and you draw a line under it. And then the total is going to be, I am able, I am able, I am able, I am able. Well, that does not equal disability. Now, on the other side of that, when you're answering, what are you able to do? If you're saying that I need help with showering, I have to leave the door open so somebody in the house can listen out for me and make sure that I'm okay. I'm not able to raise my hand above my hair and brush my hair. My hand is a little bit unsteady and I need help with shaving. I'm not able to fix a meal. I can go to the microwave and put something in the microwave and sit down for a few minutes, but I'm not able to fix a meal. I am not able to shop. I'm not able to do my laundry. I need help with doing this. I need help with doing that. When you put that one after another in a column and you draw the line and you total it, I'm not able, I'm not able, I'm not able, I need help, I need help. That makes a stronger argument for disability. And so basically, when Social Security looks at that, what they're doing is they're taking the functional activities of daily living and they're taking it as a dot and drawing a line, if at all possible, to a job you can do. But now, if you're not able and you need help, they're not able to draw that line to a job that you're able to do. So as you answer things, are you able to care for yourself? What kind of chores do you do? Do you cook, clean, drive? Do you do yard work, laundry work? Think about this. Think about this. Do you have a pet? Do you have a dog? They will ask you that. If you're able to take care of an animal that needs taken care of, needs to be fed, needs to be walked, then that is lessening your argument that you're not able to take care of yourself. So the functional activities of daily living, very important. You have to make a strong argument that you need help, that you are not independent, that you are unable to do certain things and you need help. Next. And then finally, they look at your work history and they will review that going back 15 years. And the reason being, you may not be able to do something you're doing now, but you may be able to supervise. You may know that area so well, then they want to say there's a possibility you could be a consultant there, or you could supervise that, or maybe you can do something that you did in your earlier work history. Next. So what is your part in the Social Security disability application? It is to complete and return all forms in a timely manner. Have all pertinent medical records submitted promptly. Again, not your responsibility unless Social Security cannot get them. Be consistent in your responses. Because Social Security will ask you the same thing over and over and over again and ask you in different ways. And this happens not only in the application for Social Security, but you'll find the same thing in the hearings. If you're denied and you have to go through a hearing with a administrative law judge, you'll be asked the same things. You must be consistent, but not only consistent with that, you need to be consistent as well with some of the things you're saying in your doctor's office with your clinical notes. I've had patients where they have said in a office visit this month, well, I was able to clean the gutters and I was able to do this and I was able to do that. Well, when Social Security gets and reads those records and looks at that date, and then they're saying, oh no, this person is able to do these activities. So you have to be consistent in what you're saying, both in the clinic exam, what you're saying to your doctor, and what you're putting on your application as well, because that's how Social Security is going to get to know you. They are a cold reader. They will only know you by what you put on that application and what they read about you in your notes. And your job is to make sure that you help them to understand what it's like living in your body and to walk a mile in your shoes. Answer the question, yes. But where you have opportunity, plug in other information that emphasizes your limitations, what you need help doing, what you're not able to do. Next. Applying for Social Security disability is a lengthy process. I get many people who think they're going to get it just like that. It does not happen just like that. Unless you have end-stage renal disease, end-stage kidney disease, you're on hospice, it's not going to be generally expedited. And if you have qualifying impairment, your doctor, definitely talk to your doctor. Make sure your doctor feels you're disabled. Even still, my experience has been it can go 2 to 4 years or longer for congenital heart patients with severe diagnoses and severe impairments. It is not an immediate process. So it's a process you want to prepare for. You want to make sure you have a way that you're going to pay your rent or pay your mortgage while you're waiting on Social Security disability. And so part of why we emphasize that job with a large employer, my thing is the best way into the process for Social Security is through private disability insurance. Next. So on your job, when you got to the place where accommodations, this is just not going to do it, and you and your doctor agree that you need to go out on disability, the path to that is short-term disability that you've been paying for on your job. And that usually runs about 3 months. And then it runs into long-term disability and then into Social Security disability. Most of the long-term disability companies will push you and or assist and help you to move forward to apply for Social Security disability. But if you see yourself on that path, I encourage my patients when they're working, take out as much insurance as you possibly can. Take out short-term disability, take out long-term disability. And then while you're waiting for Social Security disability to kick in, you have some income coming in and your quality of life is not diminished greatly. And that brings us to our references. Excellent book on disability, the book on Social Security disability by this group. And definitely the Social Security website has a lot of good information for you. Thank you, Becca, and I turn it back to you.
Thank you so much for that incredibly informative presentation. At this point, we have time for a couple of questions from the audience. I will start with one we received from our social media. It's a pretty common question with our patients and families. Is there a simplified version of ADA law for parents and families to look at? It's hard to read it all and truly understand what our rights are.
My apologies. My apologies, Becca. My sound is not giving me your question. Can I get you possibly to repeat it? And I'm
Sure.
tugging at my ear to try to hear it.
Is there a simplified version of ADA law? It can be hard for everybody to read it all and truly understand it.
Gotcha. A simplified version of explaining ADA?
Mm-hmm.
Okay. My suggestion would be YouTube. And I say YouTube because it's audio and visual. And we all have different ways in which we learn, and that comes to us in both ways. There are a number of ones there that are very good. There's a particular one I like, and it's something called like Danielle Ability, but she's on YouTube and really breaks down ADA and the different chapters, what guarantees what. And so that would be a particular one that I recommend. But if you put in ADA and ADAA in YouTube, you'll get a lot of information and you'll be able to find which one speaks best to you to break it down.
That's a great idea. Thank you so much for that. Another question, I applied for disability and was denied. Since then, I have just been waiting. Do you have any suggestions?
Okay. So there are a lot of possible ways to kind of interpret that. But if you've applied and you have been denied, then one possibility you can consider whether or not you want to go forward with an attorney. The first thing, though, is that you must make sure you appeal that denial within. Social Security gives you a 65-day window to make that appeal. And you could secure an attorney, but be clear whether or not the attorney is making that appeal and not you make the appeal. They do not go usually beyond that 65-day window for almost anything. You must appeal it. I tell my patients, do not set that. You can get so blown away by pulling that denial out of the mailbox. You've been expecting, you've been waiting all these months, and then to be denied, it's disheartening. But I tell my patients, do not just put it on a mantle or put it aside. Do it, because that 65-day window will pass. get the appeal in, and you get the appeal in for a number of reasons, because when you finally get a favorable decision, then you are eligible for that lump sum. If you do not appeal it, then you have to start all over again. And so the piece is appeal it, keep the application alive. You can get an attorney. Attorneys, disability attorneys, work on a contingency basis. You do not have to pay them. They get paid when you get paid. When you get that lump sum, that's when they get paid. By law, they can, usually their fees are 25 to 33%, and then any additional expenses. So that would be what you would want to do if you've been denied. And then I should mention one other thing that you want to do is you want to know your defect. And under Social Security, you can also Google this. There is the compassion allowance list. And this is a list of severe conditions that require Social Security to give you an expedited decision. Normally, when you apply for disability, you are going to wait about 4 months. They allow themselves 90 to 120 days to give you a reply. But if you have a condition, and there are 12 congenital heart defects that are on that CAL list, compassionate allowance list. If you have a CAL listing, you want to write that on your application, and you want to make sure then that you get an expedited decision. It doesn't guarantee you a favorable decision, but it guarantees you an expedited decision, which could be in a matter of weeks, as opposed to waiting months for a decision.
Thank you for that. One final question as we close out our afternoon. What is your best advice for those who are trying their best to advocate for themselves or their loved ones and navigate the school, work, or disability spaces?
Oh, I'm embarrassed to say, Becca, I need you to try to repeat it.
No worries. Good old Zoom, right? What is your best advice for those who are trying their best to advocate for themselves or their loved ones?
Best advice for those who are trying to navigate, did you say through the disability system?
Mm-hmm.
Okay. Best advice is definitely stay in care. Make sure that you have regular clinical follow-up, and that as much as possible, you're compliant with that follow-up. When Social Security reviews your application, they are looking at, when we talk about what's your medical impairment, they're looking to see, have you been sick enough to require hospitalizations? Beyond that, then they're looking at, have you been regular with medical care? Have you seen a doctor, and have you been regular with that? And also, are you compliant with that? And compliant with your medications? And then to me, beyond that, the most important thing that I would say is, I tell people sometimes, have a little notebook that you start with at the top of the morning, and maybe you just journal everything for maybe 3 days before you do that disability application. And the reason being, you want to note everything that you struggle or have a challenge doing. You have got to line up those functional impairments, again, emphasizing, I'm not able, I need help, I need help, I need help. And then the only other thing that I would say, I tell people, you apply for disability in the way that works best for you. Disability at this time is encouraging people to apply online. Well, everybody is not good doing things online or computer. And so I encourage my patients, if that doesn't work for you, call them and schedule a phone appointment. It may take 3 weeks to a month before they're able to offer you an appointment, but they are required. And they will offer you an appointment, have a representative call you at that designated time and ask you every question and go through every question on the disability application. And they'll take that application for you. Then they send back to you a written transcript. We asked you this and you answered this. We asked you this and you answered this. So that would be kind of my strongest advice for that.
Thank you for that. Unfortunately, as informational and wonderful as this conversation has been, we are out of time. We would like to say thank you so much to Ms. Moore for sharing your expertise and thoughtfully addressing questions from the audience. We appreciate your partnership in educating patients with CHD and their families, and thank you to you, our audience, for joining us as well. We would like to thank our Heart Connection 2022 sponsors. Your generous support enables us to bring crucial educational programming like this to patients with CHD and their families when and where they need it most. For more information on the Heart Connection virtual webinar series, including upcoming webinars, or to submit follow-up questions, please visit us at the website on your screen. If you'd like to support more programs like this one, please visit our website or scan the QR code on your screen to donate. We hope you'll join us next time. Have a great afternoon.